We good to go? Great. Good morning, everyone. I'm pleased to be here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nations. I'm joined by my colleague Adrian Dix, the Minister of Health, Dr. Bonnie Henry, the Provincial Health Officer, as well as Dr. Penny Ballem, the Immunization Response Team Coordinator. At the start, I want to thank all three of these individuals for the extraordinary work they've been doing, not just over the past couple of weeks or the past couple of months, but indeed over the past year, to keep British Columbians safe and focusing on the things that matter most to British Columbians. You'll recall that in late January, we were the first province in the country to announce our COVID-19 vaccination plan. Our plan was to get people immunized as quickly as we could by focusing on those that were most at risk. The most severely ill that we've seen over the past number of months have been those who are in their latter years and those that have comorbidities. So our focus has been on not just those that are most susceptible, but indeed those that are most vulnerable and the people who care for them. And I want to say that it's been an extraordinary number of weeks where we've seen 275,000 people vaccinated here in British Columbia, focusing on long-term care residents and staff, people in rural and remote Indigenous communities, as well as healthcare workers that focus on COVID-19 patients. That's tremendous success based on the amount of vaccine we've had available to us, and we're very excited today to announce we're moving in to phase 2 of our vaccination plan. Although we already have about 90% of the residents in long-term care facilities and the staff immunized, we will continue to go back to those first stages, and Dr. Henry will lay out how we're going to do that in a few moments. But today, as we start phase 2, this will include, of course, seniors 80 years and better, or Indigenous elders 65 years or older. And through March and April, we plan to immunize another 400,000 people, building off the successes we had in phase 1. That means using the same mobile clinics that we were so successful in phase 1 to make sure that independent living facilities are immunized, as well as not just residents but staff, to meet that target. Dr. Ballem will lay out in some detail in a few moments the overall plan for phase 2, but I want to just say before we start the detailed briefing that although there is light at the end of the tunnel, we are far from out of this. We have months to go, and I want British Columbians to take the good news we're hearing today with the joy that it deserves. But we need to remind ourselves, not just today, but next week and next month, that we have a long, long way to go. That means we need to continue to practice the principles that Dr. Henry has put in place over the past number of months, that we remain physically distanced, we keep our groups as small as possible, we don't come to work when we're sick, we wear masks whenever we can inside, absolutely, and in fact, whenever we are out and about for a walk, for mental health breaks, and so on. The challenges that we have all endured over the past 12 months have been profound, but the challenges ahead are equally profound. And although there is fantastic news on the horizon, it depends on supply. And I think most British Columbians know, but I want to repeat it again. We are dependent on offshore supplies of vaccines to meet our targets. The federal government has been working overtime to ensure we get access to those vaccines, but there is no domestic supplier that we can put pressure on. This is a global pandemic. This is a scarce commodity that is in high demand in every corner of the planet. That means that we have to do our level best to focus on staying safe, keeping our families, our communities, and our province in a good place as we roll out the plan. Very good news today. Dr. Henry's going to tell us a little bit about that before we turn it to Dr. Ballem and Minister Dix. But again, to all British Columbians, we need to continue what we're doing. We need to stay the course so that we can keep our families, our communities, and our province safe. With that, I'll pass it on to Dr. Henry, and we'll go from there.
Thank you very much, and good morning. As you know, throughout this pandemic, our goals have been quite clear. Our three main goals have been to do all we can to prevent people from getting seriously ill or dying from COVID-19, to keep our health system fully functioning so that anyone who needs the care that can get the care that they need when they need it, and of course to minimize as much as we can the disruption to our society, although we know that it has been profound. These goals have guided our decision-making on our pandemic response and on our BC immunization program. The scientific evidence has proven that the single most important risk factor for becoming seriously ill or dying from COVID-19 is age. The older you are, the more at risk of severe illness or death you are. That is why here in BC, like many jurisdictions around the world, the foundation of our immunization program is an age-based approach to first protect those who are most vulnerable or caring for the most vulnerable in our long-term care, assisted living, and now moving out into the community. We are starting with our oldest and most vulnerable and working from there. But we now have some new tools. First, as we heard on Friday, we now have 3 safe and highly effective vaccines available for use in Canada. The addition of the AstraZeneca and Serum Institute of India viral vector vaccine, which has been used quite a lot in many countries in the world, particularly in the UK, which will be supplied from these 2 manufacturers, allows us to be more agile in where and how we can immunize people here in BC. Unlike the vaccines that we've had so far from Pfizer, BioNTech, and from Moderna, this is a vaccine that is stable at fridge temperatures, so 2 to 8 as we call it in the immunization world. That means we can use our community infrastructure and we can be much more flexible on how we can immunize people. We can use our established distribution systems because no special freezers are needed. Once we know how much we'll be receiving here in BC and when, we will be able to further expand who is receiving vaccine. And our plan has always been to look at a parallel track for some of these fridge-stable and more flexible vaccines. And we don't anticipate that the supplies that we're going to get in the short term are going to be at the level that we have with the Pfizer and the Moderna vaccines. We do believe that we will start to target essential workers, particularly our first responders and our key essential workers who are not able to work from home. And we've had a number of places and communities around the province where we've had outbreaks. If we think about things like poultry workers, people who work in some of our mail distribution centres. So our BC Immunization Committee will be looking at how do we best use the doses that we have coming in. We expect that we'll receive our first shipment sometime next week. But once we get those details, we'll be working those through and determining who best to target with the initial supplies. So this is exciting news. That means that we will be able to move everybody up in the queue. The second exciting news is that we have been monitoring very closely from the very beginning the effectiveness of the vaccines that we have here in BC, and particularly on the elder population that we've been immunizing as a priority. And we have expertise at the BC Centre for Disease Control in particular, where we, from the very early days, we made sure that every single dose was recorded and we knew who got what vaccine when. And part of this feeds into our evaluation of vaccine effectiveness. We have seen that the vaccines we have here in BC are safe and they provide a very high level of real-world protection with the initial dose. And some of that data was presented last week from the BC CDC, which showed that the protection that we're getting after a single dose, once your body's immune system responds to that, so at about 3 weeks, is about 90%. Even in long-term care homes, our most frail elderly. This is an amazing news. We also have been working, the team at the BC CDC has been exchanging data with our colleagues across the country and similar data coming out of Quebec, as well as the UK and Israel and other countries around the world. We've also been working with our National Advisory Committee on Immunization, who spent several days this past week looking at this very same question, and I know there will be a statement coming out from NACI in the near future. The important thing that we have learned is that these vaccines work, they give a very high level of protection, and that protection lasts for many months. As a result, we are now extending the interval between our first dose and the second booster dose of the vaccines, the Pfizer and the Moderna vaccines, as well as the AstraZeneca vaccine, to 4 months or 16 weeks. In combination, With the new vaccines that we have available, this gives us a very important and very real benefit to everybody here in BC. That means we can move everybody up the list and more people will be protected sooner. Extending this second dose provides very high real-world protection to more people sooner. We will also continue to closely monitor. We're going to continue our vaccine evaluation to make sure that we can detect if there's any concerns about vaccine effectiveness as we go forward. As we know, one of the key areas that we have been following very carefully is long-term care homes, and the restrictions that have been in place in long-term care homes we know have had very challenging effects for families and for residents. So we will be revisiting when we can decrease those restrictions, given what we know now about how effective these vaccines are, and we'll have more information about that very soon. I know everyone is eager to get their vaccine as soon as possible, and that is great news as well. As we have seen that as more people are taking the vaccine and we're showing it's safe, more people are coming on board and recognizing that it will not only protect them, but their community as well. And many, many people in public health, in our healthcare system and communities, we're working across the board to make sure that we are able to provide immunizations as effectively and quickly as we can, and Dr. Ballem will be talking about that now. I want to thank everybody for their patience and enthusiasm. We have a great deal of confidence in these vaccines, that they are safe, they are and effective, and I encourage that people in BC do as well. I'll now hand things over to Dr. Ballem to speak about the specific logistical challenges and details of the next phase.
Thanks very much, Dr. Henry and Premier Horgan. It's a pleasure to be back here today to just report back on a short summary of the progress that we've made in phase one, and then just provide some really detailed information for our public around what's ahead of us in these exciting next weeks of March and into early April. This slide basically just talks about our commitment that was made in January. You know, we have committed to immunize our full population by the end of September. And our approach was divided into 4 phases. We're now entering phase 2. Both phase 1 and phase 2 are focused on priority populations, which I'll describe to you. And in phase 3, we move into the broader general population, where we will be approaching it using age-based groups. Next slide. As Dr. Henry has said, we've had 3 goals to date since our vaccines first arrived in December. Protect the most vulnerable, assisted living and long-term care residents and the staff who look after them, remote and isolated First Nations communities, and then protect our health system, both for people with COVID, but also for people with other health problems, and maintain our surgical program, just keep our system running to do the job it's here to do. Finally, vaccines are a remarkable tool to help control refractory outbreaks, and we have used those around the province to do that very successfully. So moving on to the next slide, our COVID, whoops, look, we got ahead. Bonnie, maybe you could just back up a bit, just slide 5. Yeah. So the next slide, if you could just go back a couple of, oh, okay. Yeah, there we go, perfect, yeah, sorry, no worries. So this is a graphic that I think everyone's familiar with. It shows our 4 phases and the populations in phase 1 and 2 that we are working on. You can see that in phase 1, residents and staff, essential visitors of long-term care, many isolated First Nations communities we have made very good progress. We've been vaccinating healthcare workers first and foremost in the hospitals. And as we move into phase 2, we will continue the work on those vulnerable populations. We will be branching out to congregate settings like independent living, where we have a lot of frail seniors living. We will continue on our community and you know, our broader hospital staff. You know, areas such as group homes and correctional facilities where people really don't have the ability to protect themselves. And finally, in the last 2 weeks, as I'll describe, we're going to turn our attention to our first general population group, those over 80, where we will be bringing them back in for vaccination starting the middle of March, and also our Indigenous peoples who are over the age of 65. Phase 3 and Phase 4, we're going to come back to you. They remain our broad population groups by age, and I think given the news that Dr. Henry told you about just now, that is going to change for the good. Those groups, we know they will move up. We will reach more of our population much more quickly with the extension of second doses and the other vaccines that are now getting approved and are going to become available. This next slide is a remarkable slide because it basically speaks to the fact that as vaccine has come in, and that is the pink line, that's vaccine. You can see that I've got my labels crossed over, but vaccine supply is pink, and the vaccine that we have utilized got into people's arms is purpley blue. And what you can see is there's a very, very tight relationship with those two lines, and what that means is as vaccine has come in, we've used it, and we've been vaccinating those priority populations. And I'll show you a little bit of data in a minute what that results that has provided us. You can see right at the end of February, we have more vaccine. It arrived a bit later in the week than we had anticipated, but that vaccination, we are poised and ready to deal with the remarkable increased supply of vaccine, and we will continue to keep those two lines very closely associated. On our next slide, you can see that we have strong vaccine efficacy, as Dr. Henry has referred to. It has these Pfizer and Moderna vaccines, just with one dose, are extraordinarily effective and have really reduced the incidence of outbreaks in our long-term care and assisted living sector. It has reduced the incidence of outbreaks in our acute care sector. And, you know, as we've learned, that this evidence that is both local and international is allowing us to make decisions about extending the distance between dose 1 and dose 2. What that does is free up more vaccine for our population. I'm just going to show you a couple of data slides, if we can advance the slide, just to show you just how remarkable the impact of these vaccines have been. So the first one relates to long-term care residents. And on the left-hand axis, the vertical axis, it's the number of cases after vaccination. And on the bottom line, it's the number of days after someone has got vaccinated. And when we looked at all the residents of long-term care that had been vaccinated and then tracked all the new cases that flowed after those initial dose 1 vaccinations, what you can see is for the first 2 to 3 weeks, we continued to get some cases which started to fall off midway into the third week. And then after 3 weeks, it drops down to 1 case here, 1 case there, and then to nothing. And that is absolutely our experience, and just such a miracle for us in that sector to have finally been able to protect those residents. And in the next slide, a very, very similar pattern for our healthcare workers. Those healthcare workers, you can see the same pattern. If you look at their experience in the 2 to 3 weeks after they've been vaccinated, the new cases amongst them falls right down, and after 3 weeks, it basically drifts off to zero. And that too has allowed us to protect our healthcare system, both in the long-term care sector and in acute care. And as we move our vaccinations to those who work in the community, we will see the same impact. So in summary, from the 13th of December, when the first vaccinations rolled into British Columbia, all the way to the end of February, we have basically dramatically reduced outbreaks and infections in assisted living, long-term care amongst the staff and the residents. We've stabilized and diminished and closed down the outbreaks in our acute care sector, and you will recognize a number of hospitals you've heard about were impacted by that. And we have reduced other outbreaks that are in our communities and First Nations communities and other settings where we actually have brought outbreaks to a close that have persisted and not responded in the way we would like to our foundational public health measures. So I'm going to move on now to what's ahead of us in phase 2. And I think the next slide shows that our intention is, as the Premier indicated, is to vaccinate another 400,000 British Columbians in March and early April. And I think we can anticipate that number will go up, because with the decision to extend the dose 2 timeframe, we know right away we will free up another 70,000 doses. And then to achieve dose 1, so to expand the coverage in our population. And in terms of the new vaccine, AstraZeneca, that will be arriving, we don't exactly know how much we'll be getting, but that too will allow us to actually increase that number. So these next couple of slides really deal with vaccine supply, and we're very confident in the coming weeks in March that the vaccines from Pfizer and Moderna that have been committed to us are going to arrive. The Moderna arrives a little bit into the mid and late part of March. Pfizer is on a weekly basis, and although we have had issues in the past weeks, now the flow is starting to significantly increase, and we anticipate that we will be getting those occasionally to one or another health authority where the travel is more complicated. These things do get delayed, and we're learning to accommodate and anticipate those things. But generally, we have a lot of confidence. The populations that we'll be addressing, as I said, we've got priority populations that remain to be finished off from phase 1 and phase 2, about 190,000. We've got remote and isolated Indigenous communities we have to finish off, and some communities with clusters. We will then turn our attention to people born before 1941 or on in that year, and those are the 80 plus. That's our first population group, and along with them are 65 plus Indigenous peoples who will be coming in to get vaccinated. You can see there's a very good match between the pretty solidly anticipated supply of Moderna and Pfizer and the remaining population that we want to vaccinate. This next slide basically covers ground that Dr. Henry has talked about today, so I'm really not going to go into it. But essentially, as I said, we will have about 70,000 extra dose 1s to actually expand the spread for our population. Very much appreciated, and there will be another 40,000 that will be coming back to you in the coming days to say, these are extra dose 1s that we have available to us, and here's how we're going to deploy them to expand the protection of our public. Dr. Henry has already addressed the issues of AstraZeneca and Johnson & Johnson. We expect that we'll get about 660,000 doses of AstraZeneca in March. We expect it to arrive at the end of the first week in March. We're not exactly sure the exact amount, but that's the range. And as Dr. Henry said, she will be coming back to our public with, how we're going to utilize that in the most strategic way to advance the management of our pandemic and protect our population. And as she said, the Johnson & Johnson vaccine has been approved by the FDA in the United States. It's being studied by Health Canada. It's another possibility about which we don't have much information about the volumes that will be available to us and when those will be coming. So future news for a future day. So I want to return back then to the more detailed plans for phase 2, and particularly those that address our population-based groups of seniors over 80 and First Nations Indigenous peoples over 65. So this next slide basically talks about the phase 2 timeline. And we basically divided March up into 2 tranches. The first, March 1st to 15th. And that we will continue, as I said, with the remainder of our phase 1 and our phase 2 priority population groups. High-risk individuals in congregate settings, in shelters, in correctional facilities, in group homes who are quite vulnerable. Continue on with our healthcare workers, our high-risk seniors living in independent living, both them and the staff that look after them, high-risk seniors in supportive housing, and long-term home support clients who are living in their own homes, often with family, but are receiving regular support to help them manage in their frailty. And moving on to, our next slide, really now our first age-based population cohort over 80 and Indigenous people over 65. This is the first age cohort of the general public to be vaccinated. It's very exciting. It's the start of our age-based vaccination program. And what we have done, because these are our elders in our community, both Indigenous and in the general population. Some of them are quite frail, some of them are very vigorous. And we've set up a system here for the last 2 weeks of April, last 2 weeks of March and the first week of April, to actually bring them into clinics that are pretty familiar to them based on when they get vaccinated for the flu. So community-based clinics that the health authorities will be setting up. We will have them call in and make an appointment to come into those clinics. And those call centers to receive those calls will start on March 8th. Every health authority will have a call center with a unique number. The appointments can be made for the available clinics in these communities. And we will, in order to manage the volume, because there's about 175,000 of our public who are over the age of 80 who are going to be enthusiastically responding to the opportunity to get vaccine. And we know their families have been fussing about them and wanting to get them in and get them protected because they know, as Dr. Henry has told us, that they're the most vulnerable. So we are going to divide our over 80 population into subgroups based on their year of birth and their corresponding age, in order to not overwhelm our call centers right off the bat, because we've seen that happen, and we can protect to a certain amount against that, and we know our public is going to want to cooperate so that we can get our elders in the community vaccinated. And there are some communities where they're so small that they will be vaccinated in total, and I can give you information about that later, and it will be on the health authority websites. But basically, on the next slide, you can see the construct of how we're going to have people call in. So we'll divide it up into 3 segments. The first one, starting the ability to call in and make an appointment for a vaccine, will be those over 90. And it will be by year of birth, so they are born in or before 1931. The next group will call in starting March 15th. And their vaccinations will start March 22nd. So you see it will be a week and a week for the call and then the vaccination. So for those over 85, their year of birth is in or before 1936. And finally, the group over 80, which is our largest group, they can start calling March 22nd to their local health authority call center. Their vaccinations will start March 29th. And their year of birth will be in or before 1941. For our Indigenous people, they can call in starting the first week, and we will vaccinate them throughout the full time period. People should only call in when they're eligible, and we really encourage our media colleagues and our MLAs, our communities, family members, to actually help people understand why this is so important, so that our ability to respond and book people in these age segments isn't interfered with by just the technical overwhelm of call centers by so many people all calling in at once. But reassure them that everybody's going to get vaccinated. We will reach everyone. If they miss their eligible call date, it's no problem. Once they're eligible, they can call any time after that. And we want everyone to understand that they don't have to rush to be the first caller. They will get their vaccine. They will get it in their community. And it will be, a remarkable event. So just moving on for a little bit more detail, because many people over their 80s might need some help with calling in, we're going to make it very easy for that. If they have a family member, support person, a friend who can actually help them call into the call center, or even use their mobile device or their email to get the confirmation that they're over 80 elder or senior is actually booked for a vaccination. We were encouraging people to get help if they need it, and not to feel that they have to, navigate this system all on their own. We also have the government BC Seniors First website will have lots of information, along with the health authority websites, about where and how you go through the steps to get yourself an appointment and get in to get vaccinated. And just a thing to remember, because we have had some instances of phishing already, health authority call centers will never ask for your social insurance number, your driver's license, any banking information, your credit card. That will not happen. And if our seniors find themselves on a phone call where people are asking them that, they're on the wrong phone call. and then they're on the wrong number, and they need to get off the call and find out the right number to call, because that will not happen. On the next slide, this is just a bit of information for our public about what can they expect the information they will need. They will need their first and last name. They will be providing their date of birth, and if they're ineligible for that week, they will be nicely told that they have to wait till the next week. We will need their postal code so we can map them to their health authority and to other information that will be important. Their personal health number. And many people may not know what their personal health number is. It's the thing that's on the back of either their driver's license, their BC services card, or many people still carry around their care card that you can see in this slide. And that's all the personal health number, and that's a very important number for them to have ready for us. And then contact information, either their own as a senior or the contact information for their support person. And they will get their appointment confirmed both on the telephone and then by email or text. So let's just walk Mrs. McWhinney from Richmond, who's 86 years old, through her process. So Mrs. McWhinney is going to hear on the radio, on the TV, she might have her daughter call her friends, her church group, her social support network, her seniors network might say, "Oh, it's time for you to get your vaccine. You're eligible now." And she can learn of the steps to get that vaccine through her support network by going on the government website, by going on her own health authority website, which will lay it all out very clearly. We will be running ads in the paper and on the internet. Like, we are trying to get a multi-channel approach out, also through civil society organizations who work with seniors and with people in the immigrant and refugee community. So we've touched base with all of them, and they will get this information. So it's through our whole community that our seniors will learn that they're eligible now for vaccination, and also help explain the year of birth segmenting that we do to protect our call centers. So Mrs. McWhinney can call the Vancouver Coastal Health Call Centre on her week of eligibility, which will be after March 15th, because she's 86, born on her year of birth was 1934. She'll talk to an agent, schedule an appointment, book a location, and then she'll receive confirmation by email or text, and either that will go to her own email or text or her mobile phone, or that she's provided of a friend or support or a family member. And she will get vaccinated the week of March 22nd. So what if Mrs. McWhinney calls and it isn't her week or her by age to call? And if that happens, she will very nicely be asked to call back during the week that she is eligible and book any time after that. And what if the call center queue is too long for her? We will have a queue that is a reasonable length of time, and after that we will ask people to call back later when the loads have come off. And we know that these are things that happen. Every jurisdiction we've talked to has experienced these issues in the early days of opening up to the broad public, and it's just something that we hope everybody will help us manage through the segmenting of age, and also just encouraging people just to call when it's clearly their week to be eligible. And if Mrs. McWhinney's daughter or neighbor is calling on her behalf, no problem. The booking will be made, the contact information will be clarified, and then if Mrs. McWhinney has questions about her vaccine, about the safety, or other COVID issues, there is the COVID line she will be able to call and ask her family doctor, who is well informed, and also go on the Health Authority, the BC CDC website, and the government website. So this next slide is really a social media graphic that we will be using just to clarify these dates so everyone understands when it's their time to call and when they'll get their vaccination. So I'm not going to walk you through that again. I'm just going to quickly talk about Phase 3 and Phase 4, which, as we look ahead to the rest of our population, we know it's going to change. So just right up front, we've just had this news of AstraZeneca at the very end of the week, not quite sure the exact volumes. And then, as Dr. Henry said, the extension of dose 2 will make a big, big difference to our ability to vaccinate our mass population. It will effectively, when we modeled it last night, it will likely result in by mid to late July that we will have been able to give a first dose to everybody in our population, which is a significant shift from our earlier plan out into September. So we will be coming back with the details on that. So it's very, very good news. Very good news for returning to life as usual. But as the Premier says, in the meantime, we have to still pay close attention to our public health guidelines. But phase 3 will begin in mid-April. And the one thing that will be a major transformation is that we will have a provincial digital platform at that time. There will be a very robust online registration and booking system. We will have a provincial call center, one number, that will actually allow people to get help from a call center if they require it. But as we move down in the age groups, we know more and more people will want to book themselves online. They're very used to that. And that in and of itself is a major, major step forward for our whole vaccination program, not just for COVID, but for all vaccines in British Columbia. And to Dr. Henry's point, our ability to track every vaccine that's given, who it went to, where they live, how old they were, and in the case of these these first two phases, what priority group they were in. It has allowed us to track, real-time vaccine effectiveness, where we have gaps in reach, and to readjust and reconfigure our approach. So really, this will be a big step, and we'll be coming back to talk to you about all that in the near future. So in summary, we plan to vaccinate 400,000 people in BC or more in March and the very early part of April. The first 2 weeks in March, we'll be reaching out through the health authorities to reach people in different settings and finishing off our priority populations to the greatest extent possible. And from March 15th on, our first age-based population group will be coming into our vaccine clinics, our seniors that we've all been waiting and anticipating their ability to get protected by these really incredible vaccines. So I really appreciate your time today, and I'm going to stop there and I think take any questions for any of us here at the podium. Thank you very much.
Thank you, Dr. Ballem. We'll turn to media questions now. First on the list, we have Katie DeRosa, Vancouver Sun. Katie, your line is now open.
Hi, thank you for taking the question. I wanted to find out whether, with the presence of the AstraZeneca vaccine, if individuals will be able to choose which vaccine they get, or like Dr. Henry mentioned, if certain higher risk workers could move up the queue if they opt for the AstraZeneca vaccine.
Yeah, so that is a common question that people are wondering about. So there will be a limited amount of choice. So as you know, we've talked about targeting these fridge-stable vaccines to first responders and essential workers. And yes, they will have a choice to receive that vaccine in the near term, or to wait for their age group to receive the Moderna or Pfizer vaccine. So we obviously encourage people to get the vaccine that's available to them as soon as possible. And we know how exciting it is to have 3 now very safe and very effective vaccines. So we will be targeting those to that specific population. So there will be a little bit of choice, but not a whole lot.
Follow up, Katie?
Yes, when will the specific call-in numbers and the website to register be released?
The health authorities are preparing their communication plans, and they will be released toward the end of today. And we will be publishing the call center numbers and the online for Fraser Health. That's the only health authority that has an online system at this point due to their large numbers of seniors. But just to be clear, those won't become activated until the 8th of March. That is when we will start calling in our seniors for those plans. So just wanted to be clear on that. Thank you.
Next, we have Richard Zussman, Global News. Richard, please go ahead.
There seems to be a lot of information out there, and I think this is either for Dr. Ballem or Dr. Henry, about ways in which those in their 70s can register, and it includes the Service Card app. Is this part of registering for the vaccine for those in their 70s, or is there no way yet for those in their 70s actually to do that registration?
So I think there has been some awareness that that there's emails floating around and information about the necessity to use the BC Service Card and the BC Service Card app. If you have a BC Services card or you want to apply for it, it can enable you registering when we get to the mass immunization program after the middle of April. But it is absolutely not a necessity for anybody at any time. You will be able to register, during our seniors vaccination program for over 80s and over 65 Indigenous during the rest of this month and early April, and beyond into the broader general population. There will be no necessity to have to utilize a BC Services card if you don't have one or if you don't want to apply for one. So no, it's not necessary.
Follow-up, Richard?
In terms of the distribution for 80 plus, those in assisted living, does the age matter? As in, if you're in assisted living now, when the vaccines start this week, in your 70s or 60s, can you receive the vaccine? And how will you ensure that there's no waste of the vaccine if you're doing home visits when there's 6 shots in a vial? How will you ensure it gets to the 6 homes in time?
Yes, so very, very good question. So first of all, Richard, we finished assisted living, but it's independent living, I think you might have been referring to. And we will be going out to independent living and we will be vaccinating. There are many frail seniors in independent living, and our decision has been to vaccinate everybody in independent living, along with the staff who are looking after providing support services if they're needed. So we will do everyone in that setting. And in terms of visiting home care clients, we will have mobile units. It will be organized in order to optimize the use of vaccine and not incur any wastage. We have some time frames that are clear. We're able to use preloaded syringes for that, and we can do that quite efficiently.
Next, we have Shannon Patterson, CTV News. Shannon, your line is now open.
Oh, hi, doctors. Just wondering if there is some concern that when you advertise a line that people can call to book a vaccine shot, that it will be inundated with calls from people who aren't eligible, younger people trying to convince the call taker that they should be vaccinated, general questions. You had said in the tech briefing in Alberta, there were 170,000 eligible people and 2 million calls. So will the system be set up to deal with the fact a lot of people are going to be calling in who probably aren't actually eligible to book a vaccine that day?
Yes, that is an issue that all jurisdictions have faced. Going out in a very proactive fashion as we have today, and we will continue to do over the next week to help people understand why we have segmented the population and why it's important not to phone in and try and convince people that, you're only 44 but you need a vaccine, because what that's going to do is interfere with getting our most frail, oldest age group, our seniors, vaccinated, those over 80 and over 65 Indigenous people. So, I think what we're going to do is we're counting on everybody. It's a whole community that's going to deliver this. Everybody's going to get vaccinated, and we have to focus now on this particular age group, and they're very important to get protected. Dr. Henry has been pushing us hard to get to the point where we can start vaccinating them and making sure they're protected. And I think we just need to depend and give all the information to our whole community, to organizations that work with seniors and their families, and just make sure that we respect what we're trying to achieve. If a call center goes down, we will put it right back up on its feet as quickly as possible. And, that's the reality of it. But we're hoping to avoid that if at all possible.
Follow-up, Shannon?
Yeah, this might be for Dr. Henry or Minister Dix. Can you talk a little bit about the staffing of these call centers and the mass vaccination sites? Are you guys reaching out trying to hire a lot of people now? Where will they come from? And is there any concern you won't be able to find enough people to do this? It's going to require a lot of people.
Yes, you're absolutely right. Our mass vaccination program, starting in April, is going to require a lot of people. You can see as the vaccine volume goes up. We're doing a lot of planning work. You start with how many immunizers you need, and then you work backwards from there to understand all the other staff that are required to, undertake a big setting like this to vaccinate people. So we've got a lot of planning done. We've had, a lot of really remarkable responses from our community partners and from our business sector who want to help. So all of those details are, basically well underway. And, we look forward to coming back and giving you the whole story, looking ahead into our mass vaccination program through April, May, June, and July. Yes.
Just to say that we talked about last week that we want to expand the pool of immunizers that we have available, people with that skill set to do different parts in our clinics, whether that's pharmacy technicians drawing up vaccine in a systematic way, engaging with fire services, with other medical professions. And so I have issued an order, a PHO order, that allows that to happen. And we're now adding as well retired physicians beyond 3 years. So all of those things are coming together, and each health authority is working with each specific clinic. So these last few weeks, these are the things that we have been consumed with. And it's one of those things where there's many, many moving parts that we're pulling together. We have a standard approach to the mass vaccination clinics. And yes, we are expanding our pool of immunizers who are able to work in those clinics underneath each of the health authority organizations.
Next, we have Tanya Fletcher, CBC. Tanya, your line is now open.
Thank you. By delaying the second dose to 4 months, I think you mentioned everyone in BC who wants one could be vaccinated with a first dose by July. So does that mean everyone in BC will be fully immunized with a second dose now by November? It sounds like this current timeline is going to be dramatically altered. When might you be updating that schedule accordingly?
Yeah, so these are our decisions that have gone through our immunization committee, through our public health team, and we made them based on the data that we have and the evidence that we have now about how to best protect people in the short term. We also know that our vaccine is back-end loaded still. Even though we're getting more now, we're going to have a lot more come third quarter, come into the summer, and we will be focusing then on second dose clinics starting in July. And we can have different strategies for those. So now that we know this information, we know as well that there's new vaccines coming online. We're going to be rejigging all of those timeframes, but I think it's really good news. It means that everybody moves up in line, and we have such good protection from all of these vaccines after the first dose. But it does take some time. It takes 3 weeks on average before we have that maximum protection. So we're not out of the woods yet, but you're absolutely right. We'll be focusing on second doses starting in the summer. But we will be able to do a lot more in our post-pandemic reality once we have so many people in our population protected.
Tanya, follow up?
Yes, thank you. You had mentioned how hopeful you were about accelerating the timeline for essential workers like paramedics and poultry plant workers, but can you provide more detail on how this might affect the timeline for other frontline workers like grocery store clerks or perhaps teachers? Might they be bumped up ahead in the queue as a priority? And if we could get an answer in French as well, please. Thank you.
So we are looking at all of those things. So we have first responders who we know about, police services, fire services, correctional officers, our 911 dispatch officers. We know right now paramedics are included with healthcare workers because of their roles in hospitals and care homes. So that is one group. But then we have a whole group of people that we have come to appreciate are part of what keep our economy, but keep our society functioning during this pandemic. And that is everybody from educators, poultry workers, grocery store workers. And we are working on how to, which of those are most at risk from infections and outbreaks, and we've seen a number of outbreaks in some of those settings, who are best able to protect themselves with the personal protective equipment and the COVID safety plans we have in place. So we will be looking at that in some detail and being able to provide a risk-based approach to those populations as well as we learn more about how much vaccine we're getting when. So yes, those are all details that we're continuing to work on through our BC Immunization Committee.
Oui, effectivement, il faut dire que déjà le service d'ambulance fait partie de notre système qui est en train d'être vacciné, ont déjà été vaccinés en Colombie-Britannique. Donc, pour l'ambulance, c'est déjà fait ou en train d'être fait. Mais pour les autres services essentiels dans la société, oui, la présence d'AstraZeneca va changer le jeu en quelque sorte, donc va donner l'opportunité à d'autres groupes d'être vaccinés. Ces décisions vont être faites de la même manière qu'on a fait jusqu'à maintenant, c'est-à-dire on va considérer les risques des gens et on va agir en considération de cela. Donc cette décision, il y aura des recommandations dès cette semaine de la santé publique, de Dr. Henry, de son équipe, de Dr. Ballem et tout le monde vont en parler avec moi, bien entendu, et on va prendre des décisions cette semaine parce qu'on s'attend à des vaccins d'AstraZeneca qui vont venir en Colombie-Britannique dès la semaine prochaine.
Next, we have Lisa Yuzda, News 1130. Lisa, please go ahead.
Hi there. You mentioned using plans like were used for vaccinating the elderly for flu. So I'm imagining that means using health units and things like that. When do you go beyond that? And where are you at with setting up places like arenas and centers and community centers for these larger groups? And when are we going to see those open?
Yes, so for our seniors, we'll be starting the vaccination clinics starting March 15th. Will be available for them to come into, and many of them, some of them will be in community centers, some of them in different community places where we routinely use for vaccinating those groups for the flu. But when we get into March, starting March 12th, we will have April. When we get into April, starting for the broader population, 75 and up and under, we will have mass clinics that are being basically set up, locked down as we speak across the province. Some of them will be very larger than anybody has probably ever experienced in Canada, and others in small communities. Small communities, will probably use the traditional settings they have all along, because we can, if we're there for a week, we can manage to get people vaccinated through that time frame. So we will be coming back to just basically talk about all these various components of this, a little later on in March. So right now we're trying to focus on the over 80s, but there's a massive effort underway with the health authorities, community partners, Immunize BC, the ministry, Dr. Henry's office, to actually prepare for the broad general population vaccine by age group that's going to be rolling out April 12th and beyond.
Lisa, follow up?
Yes, I'm wondering, what could derail this plan as it laid out? How confident are you that what's coming for vaccinations, for vaccine supply is guaranteed or more, or could there be a hiccup there? And what about people who get vaccinated who are like, I can live my best life now because they've been vaccinated while, thousands and hundreds of thousands others have not?
Right. So I'm going to let Dr. Henry address the last one, but for the first one, we have had, I think if you look at our results and the flow of vaccine, yes, there have been some intermittent hiccups. Some of them have been due to Mother Nature, to weather issues, other due to planned, or maybe unanticipated, but planned production facility remakes by our vaccine producers who are trying to keep up with global demand, which is good news. And adjusting to those shortages in the short time frame is actually, the least we can do in order to assure that we have sufficient supply and the kinds of volumes that we're anticipating going into the sort of April onward, where we're trying to protect our whole public. So, we have good confidence. I think we, as the Premier has said, these vaccines are being manufactured outside our country. We don't have endless control. The federal government has contracted with a broad number of vaccine producers for vaccine. They've contracted for more than we're actually going to need in Canada. And, I think we have great faith that will all happen and that the vaccine will flow. And we're already seeing the results of that now with the AstraZeneca arriving sooner than we had anticipated. Even Pfizer and Moderna arrived sooner than we had anticipated. So I think we're confident, but we know we as a country don't have total control over that. I'll just pass it over to Dr. Henry.
I've said this a couple of times that we're in this very challenging phase where we're still in winter. We still know that this virus transmits very easily at this time of year. We're hopeful as we're going into April that decrease in transmissibility will enable us to go back to some of the things that we were doing even as late as October, where the safety plans that we had in place then were working. So I'm thinking about whether we can go back to having even in the short term, outdoor gatherings, having indoor gatherings with small numbers of people as we move into spring. But we're not there yet, and we don't yet have enough vaccine and enough people protected in our communities that we can let our guard down. And of course, we have that spanner in the works of these new variants of concern. So we remain in this huge positive vaccine hope, and we know that there's going to be more vaccines coming, more people protected sooner than we had originally planned for, and we were cautious in those plans, and that is the good news. But we need to all hold on for a little bit longer. We are now in those final miles of this marathon. We know there's an end point in sight, and it is weeks and months, not some nebulous gray next year maybe. So this is where we need to all just focus and support each other a little bit longer to keep doing those things that we're doing so that this virus doesn't take off right now when we're so close. So we need to continue, as the Premier said, to use all of our layers of protection right now as we're able to roll out vaccine to protect people in as fast as we can in our systematic way over the next few months.
Next, we have Camille Baines, Canadian Press. Camille, your line is now open.
Hi, thank you. Dr. Henry, I'd previously asked about the plan for Indigenous peoples, vaccinating all of them, as the Federal Indigenous Services Minister has talked about getting provinces to do that. Can you please be more specific about what the province's plan is beyond rural and remote communities?
Yeah, so from the very beginning, we have ensured that our First Nations partners have been involved in all of our planning, both for responding to the pandemic, and we know, I've talked many times about how we've linked data under orders that I have given, that the First Nations Health Authority has been an integral part of all of our planning, that we've met regularly with First Nations leadership, and for all Indigenous people in BC. So we have committed to that. We've started as the National Advisory Committee on Immunization guidance and our guidance here in BC. We've started with the remote and rural communities that were most at risk, and of the 205 communities here in British Columbia, we've worked our way through completely doing an all-of-community approach with, I believe we're up to over 90 of the communities now, and the plan is to continue that process. We did have some delays, as we all know, with vaccine shortage over the last few weeks. That has meant that we focused on Indigenous seniors and elders, so people over age 65 and elders in some communities that were more closely related to our urban areas. But with the now change in delaying of second dose, that gives us more ability to go back to our all-of-community approach. And as we've talked about, Indigenous people, so that's First Nations, Métis, and Inuit here in the province who are 65 years and older and elders are included in this Phase 2 here in March. So we expect to be able to provide vaccine to all Indigenous peoples in BC in the next few weeks.
Follow-up, Camille?
Yes, I'm just wondering if you have any concerns at all about healthcare workers beyond those in long-term care and assisted living, perhaps not wanting to be vaccinated.
You know, this is something, vaccine hesitancy, and what we're trying to talk about is vaccine confidence. And one of the things that is so important in inspiring confidence in the vaccines that we have is that close monitoring for safety and effectiveness that we're doing through the BC Centre for Disease Control. Dr. Monica Naus and Dr. Dudanis Skowronski have been the leads in this, and we have a lot of expertise in pulling that information together so that we can show people that these vaccines work and that they're safe. And that's a really important question that I get asked a lot from healthcare workers. We've had very good uptake in healthcare workers, both in our hospitals, in our paramedics, the people who work in long-term care and assisted living, but it's not universal across the board. There is, of course, some people who have questions. These are new vaccine technologies. The AstraZeneca vaccine is one that is a technology that's been used before, so that helps build a little bit more confidence in it, but the messenger RNA ones are new, and so people understandably did have some concerns, but we have seen very high uptake in most settings. There are some communities where immunization is not well supported, and we are addressing some of those needs by providing the information that people need, countering some of the misinformation, and we have seen that in some communities that there's misinformation that's circulating, particularly on social media. And we've been working with leaders in those communities to help people understand what is truth and what isn't. And I would refer everybody to the BC CDC as a source of truth about these vaccines and all immunizations. And Immunize BC has very detailed and good information that helps dispel some of the concerns that we see floating on social media in particular. But we do have work to do. We know that for very good reasons, some First Nations communities have concerns about new vaccines and about access to them in this early phase. But I think we can be reassured by what we are seeing around the world that these vaccines not only work, but they are very safe. And one of the reasons I myself received my vaccine was to show that I have full confidence in these vaccines. And I will say as well, so that anybody's wondering, I have not yet had my second dose, and I have been watching this data very closely and will be receiving my second dose about 4 months, or maybe even longer if we determine that that's a better for our own immune system. So.
Next, we have Prabjot Sohal from Red FM. Prabjot, go ahead.
Thank you for taking my question. I think Dr. Henry answered some of the question, a bit of it. But again, I'll try it again. So because of the variant exposure in schools in Delta and Surrey, a lot of teachers are concerned, and their concern basically is that either the work safety measures should be increased or mask mandate should be extended. And now that there is more vaccine available with the extension of the second dose and AstraZeneca coming in, do you think you might end up prioritizing teachers in the province as well? Or you would rather consider extending the mask mandate or other safety measures?
So, we've talked about safety measures in schools many times, and yes, we do know that in areas where we have more transmission in our communities, that's reflected in exposures in the school setting. Thankfully, we know that the safety plans that are in place mean that there's very few transmissions that happen in schools. So people are not getting infected at a high level in schools. And we're working very closely. And I know Fraser Health and the Surrey School District are looking at everything. They're reviewing all of the COVID safety plans, and they will make decisions about how to best support the safety plans that are in schools in that district and as we have in every other district. So absolutely, we know that people who cannot work from home, and we know how important it is to keep our educational system going, how important it is for children and young people to have that. So teachers, educators are on that list of people that we know are essential workers, and we will be coming up with a plan for how we can provide vaccine to them, and it will be based on how much vaccine we have, what vaccines we have available, and when.
Prof. Judge, do you have a follow-up?
Yes, my follow-up is related to the vaccine hesitancy, and this was something that now that we are entering into mass vaccination phases, what is the province planning to do when there are cases of adverse event reporting, whether it is true or false? How do you plan to deal with that?
So we do have a system for reporting of what we call APHIS, adverse events following immunization. I do report on that weekly, but it also information available on the BC CDC website. So we watch that very carefully. This is why I've been so fussed from the very beginning about why we need to know exactly which vaccine went into which lot number of which vaccine everybody receives. That's really important because we know from history with vaccines that sometimes production things can happen or certain lot numbers even can be affected. So we want to be able to find everybody if we need to. We've also known that we've had some, most of the serious adverse events that we've seen with these vaccines, now with hundreds of thousands that we've used here in BC, but also with the millions of doses that have been delivered around the world. One of the things that has shown up is people having anaphylaxis or a severe allergic reaction. These are things that we see with many vaccines. They're quite common, and when we deal with large numbers of people being immunized, we expect to see these. And this is why we're taking the time that we need to make sure that everybody who works in our immunization clinics knows what to do. It's not just putting a needle in somebody's arm. It's about what does the vaccine, what are the contraindication, who are the people who shouldn't receive it, what are the things that you can expect when you receive it, and we make people wait and ensure that if they do have any allergic reaction or symptoms, that we're able to treat it right away. And that is what has been happening across the board here. We have had last I checked, it was, I won't say a number because I can't remember off the top of my head, but we had a couple of dozen people in clinics around the province who have had an anaphylactic reaction or an allergic reaction to the vaccine. All of them have been treated on site, and we have had no deaths related to the vaccine, either from anaphylaxis or from any other side effect from the vaccine in BC, and there are no deaths related to the vaccine that we're aware of across the country or internationally. So that is really good news.
Last, we're going to Mike Hager, Globe Mail. Mike, your line is now open.
The original date for those 80 and over and First Nations people 65 and over to get the first dose was the end of March. Can you give me kind of the key date you think this will now occur and why that delay?
Well, I can speak to that. Part of it is the very real delay that we had for a period of weeks in the end of January and into February with receipt of the vaccine, the Pfizer vaccine, and then the reduced amount of Moderna vaccine. So the bottom line is we did not have the vaccine for that period of time. So it has meant that finishing those populations has been delayed for several weeks. But the good news is that this vaccine is back-end loaded, and we know the federal government is working very hard to get as much of it as soon as we possibly can. So we will be making up, and we're hopeful that we'll be making up even more by the end of March and into early April.
Mike, do you have a follow-up?
Yeah, thanks for that. The AstraZeneca has shown some real concerns with the South African variant. Are you being a bit optimistic with the rollout among essential workers and then perhaps the wider population? And are you worried that relying on AstraZeneca could be problematic given the variants of concern?
Yeah, so there's a couple of things around that. We really have to realize that there were differences in the research protocols, in the settings where the clinical trials were done, the timing of the studies. So you can't compare the AstraZeneca vaccine to Pfizer to Moderna in a direct comparison. What we know is that all three of these vaccines have really impressive efficacy at the most important things, which is severe illness, hospitalizations, and death. And that is an incredibly important thing for us to focus on. Yes, the studies that were done, the small number that were done in South Africa showed the AstraZeneca, but also some of the other vaccines had reduced effectiveness against the variant that is most common there. We are not seeing challenges that way, as far as we're aware, with the AstraZeneca that's been used in the UK against the UK variant, which is the one that was most prevalent when the AstraZeneca clinical trials were done, so that's reassuring. So far here in BC and in Canada, we've had very few introductions of the South African variant, so that also is reassuring. The challenge we all have is that as more vaccines are coming in, we need to keep control of those variants and all transmissions in the community. We do not want to see variant infections taking off and undermining our ability to provide protection to people and to stop those serious illness, hospitalizations, and deaths. So that's the place that we're in right now. We are fully confident that the vaccines that we have available now, whether it's AstraZeneca, well, we don't have it yet, but very soon, the AstraZeneca, the Pfizer, and the Moderna are providing very strong protection to the virus that's circulating that we're seeing now here in BC, and we need to keep it that way.
To close, we'll throw it to Premier Horgan for some final remarks.
Well, thank you, Dr. Henry and Dr. Ballem, for that comprehensive review. I just want to lean into a couple of the issues that were raised by Penny and Bonnie. Firstly, it will be a year next week when Minister Dix and I and Dr. Henry announced our pandemic response plan. Not yet a year since we all found ourselves in this most unfortunate of circumstances. And if you think about at that time, we were looking at an 18-month horizon to see vaccines coming into British Columbia. And here we are, not yet a year into our plan, and 275,000 British Columbians have been vaccinated. Dr. Ballem has laid out the plan for another 400,000 in the next number of weeks. This is extraordinary progress for all of us in BC, in Canada, and indeed around the world. But we are dependent on offshore resources in this instance. And I want to tip my cap to the extraordinary work of Health Canada, Dr. Tam and her team, and also the BC Centre for Disease Control, who was leading the way in the research that we're doing with Dr. Henry and others. We are profoundly fortunate in British Columbia to have such a quality team focused on making sure that all of us stay safe. But we have a role to play as well as citizens. We have a responsibility to each other, to our families, and to our communities to continue to follow the principles that have been put in place with respect to physical distancing, with respect to mask wearing, and acting appropriately in every circumstance we find ourselves in. That's our obligation. That's what we need to do, to pay tribute to the people at the BC Centre for Disease Control, to the people on the front lines, whether they be in our healthcare institutions, our grocery stores, our schools. We have an obligation to do the best that we can do. I'm very proud of the work that we've done to this point in time. Not yet a year into the pandemic here in British Columbia, but let's keep going. Let's continue to focus on having a safe summer. Let's look to July when we can have the vast majority of British Columbians immunized and we can carry on with our lives. That's the challenge for all of us. Let's all focus on making sure that we meet that test, not just for our families, but for all British Columbians. Thanks very much.
Thanks very much, everyone. This concludes today's press conference.